Colleagues vote for this bill, they will vote to put insurance companies back in charge of people's health. When they vote for this bill, they will be voting for an initiative that deprives patients of their rights, of ending, making a pre-existing condition a reason for discrimination. That's what a vote for this does. That's the joy of the Affordable Care Act. No longer will being a woman be a pre-existing condition. People with pre-existing condition can no longer be denied coverage. Annual or lifetime limits are eliminated. Insurance companies must spend their money on insurance. That's what people bought. And they must do it in a way that that focuses on health care, not on CEO pay, advertising, and the rest. So 80-20 ratio. Many people in our country have received billions of dollars already because the insurance companies have had to refund policy money because they were spending too much on themselves and not enough on employees, on policy holders. So here we are for the 40th time. What's really sad about it is not only the violence that it does to the health of the American people and to a policy that enables them to have prevention and wellness, and it's about the health of America, not just the health care. What's sad about it is for 40 times we have had an opportunity cost of using the time of this Congress to bring a jobs bill to the floor. A jobs bill that is very needed, a jobs bill that says let's make it in America, manufacture in America, build the infrastructure of America, strengthen our communities with education and public safety and the rest. Instead of that, and instead of even passing appropriations bills, the Republicans are in this aimless path, taking us into chaos as we go into August, because in September, the moment of truth will be here. The fiscal year will end on September 30th. Instead of preparing for that, the Republicans are once again on this fool's errand of making matters worse for the American people, putting insurance companies in charge of people's health, depriving patients of their rights. This budget challenge that we have is a very serious one. We shouldn't even be leaving here today because we haven't done the work necessary to prepare us for the end of the fiscal year. Instead, we are wasting the taxpayers' time and money. I urge our colleagues to vote no on this legislation. I urge the American people to insist that we get down to the people's business of job creation and to find a budget that will not destroy and question the full faith and credit of the United States of America. To find a budget that will create jobs, grow the economy, and reduce the deficit. If we don't, and we shut down government, as some on the Republican side have said, unless we repeal the Affordable Care Act, we're going to shut down government. What does that mean to you? It means to you that your 401k success is in jeopardy. It means that if you have mortgage interest payments, you'll probably pay more. Your credit card bills will probably go up because of the increase in interest. It's just not right for what it does. It does not understand the economic challenges faced by America's families who want jobs, want to educate their children, want to maintain their homes, want to have secure pensions for the future. It's just silliness, and it does not deserve even the time we're taking on the floor, much less rise to the dignity of deserving a vote by members of Congress. With that, I urge a vote no and yield back the balance of my time.
Lady yields back.
Any reserve?
The gentleman from Georgia reserves his time. The gentleman from Michigan.
Mr. Speaker, it's now my special pleasure. As I think everybody knows, the two committees, Energy and Commerce and Ways and Means, work closely together. And as chairs, Mr. Waxman and I were able to, with others, work so closely. So I now yield, as I said, with special privilege and pleasure, 2 minutes to the gentleman from California, the ranking member on Energy and Commerce, Mr. Waxman.
The gentleman from California is recognized for 2 minutes.
Mr. Speaker,
This is a do-nothing Congress. It is absolutely pathetic. There are millions of people unemployed. Are we working to create jobs for them? No. If they don't have jobs, we're not trying to help them. But what we're doing today for the 40th time is to make sure they can't get health insurance. This is an obsession on the part of the Republicans. I was commenting on it the other day in committee, and I said it's such an opposition that the law has become the Republicans' great white whale. They'll stop at nothing to kill it. And so here we are, their 40th attempt to repeal the Affordable Care Act. I think it's a disgrace. Is this all we have to do? Spend 40 separate times trying to repeal a law that is going to bring health care to millions of Americans who have been denied health care opportunities because of pre-existing conditions, because their employer doesn't provide it to them, because they otherwise couldn't afford it. It will give people in the middle class choices, and with competition between choices of health insurance, the prices will drop, the quality will improve. This whole health care bill was based on Republican ideas, including a requirement that everybody get health insurance. That was endorsed by the Heritage Foundation. So I'm astounded that we're back here today. The last thing we're going to do before we go take our recess, our vacation, and go home and tell people, sorry, we can't help you. We're trying again in the House of Representatives to repeal one bill that has been passed that can mean so much to so many. I urge that we defeat this legislation. Yield back the balance of my time.
Time of the gentleman has expired. The gentleman from Georgia.
Reserve.
Gentleman reserves his time. The gentleman from Michigan.
I now yield a minute to the gentleman from Washington, who is the ranking member on the Health Subcommittee of our committee.
The gentleman from Washington is recognized for 1 minute.
I ask you to dispense with this.
Without objection, so ordered.
Mr. Speaker, as I listened to Mr. Waxman, it's clear he was talking about obsession. And you might ask, well, why is this happening here and what's going on? This has happened before. This is the worst nightmare for the Republican Party. In 1964, the American Medical Association was flat out against the institution of Medicare. When I was in medical school, they came up to medical school, the president said, boys, there isn't going to be any medicine in this country. We're having that socialized medicine come in. It's a terrible thing. It's a world. And you know what happened? They made the people so afraid that when they went out to enroll people in Medicare, people said, well, I don't want any of that government medicine in my house. Look at Medicare today. Nobody on that side would dare take out Medicare because the American people found out that what they were told in the advertising campaign leading up to it was not true. And that's what you're getting here today. Untruths. Vote no on this.
Fired. Gentleman from Georgia.
Thank you, Mr. Speaker. I ask unanimous consent that a letter from 15 or 16 organizations from around the country endorsing 2009 be inserted into the record.
Without objection, it will be part of the record. The gentleman from Michigan.
Reserves.
Would you tell us how much time we have on both sides?
The gentleman from Michigan has 2 minutes remaining, and the gentleman from Georgia has 14 minutes remaining.
Mr. Price, are you ready to close?
I'm prepared to close.
Okay,
Yes, sir.
I'm now going to yield one of our 2 minutes to Mr. Andrews.
The gentleman from New Jersey is recognized for 1 minute.
I ask unanimous consent to the license.
Without objection, so ordered.
Thank you, Mr. Speaker. Mr. Speaker, thank you. I've sat and listened to the debate this morning and heard a lot of the slogans that we hear on this repeated again and again and again. And I would simply return to the point that I made earlier. For a family that makes $40,000 a year, has 2 adults working, 2 children, that doesn't get coverage at work, which is true for many, many Americans, maybe 35 million Americans have a situation something like that. The Affordable Care Act says that starting January 1st, for about $40 a week, they can buy health insurance from a private insurance company as good as the members of Congress have. What is the plan from the other side since they're repealing this? This bill takes that away. What is the plan from the other side to provide for that family? Now, they'll talk about bills they've introduced and letters they've written. There's not been one bill, one vote, one day that would answer that question. We eagerly await, after 1,000 days of the Republican majority, the American people eagerly await that answer. I yield back.
Time of the gentleman has expired. The gentleman from Michigan.
I yield myself the balance of our time.
Gentleman's recognized for 1 minute.
From the outset, I made clear my reaction to IRS mismanagement, called for relieving of duties of two people. But what the Republicans today are doing is using the IRS as a bootstrap to express their hatred of health care reform. I want to read this and challenge anybody to refute it. Assertions that the IRS will have access to personal health information is wrong, is deliberately misleading. The IRS will only receive routine information: name, address, family size, incomes, coverage status, needed to provide tax credits. That's it. The rest are falsehoods. I yield back the balance of my time.
Gentleman yields back his time. The gentleman from Georgia.
Thank you, Mr. Speaker. Again, it's important for folks to appreciate that the Republican goal in health care is to make certain that every single American has the highest quality health care. We simply believe it ought to be patient-centered health care, and my friends on the other side of the aisle talk about patient-centered health care, but what they support is Washington-centered health care, with Washington making decisions. We believe patients and families and doctors ought to be making medical decisions. Now, what have we heard in opposition to this piece of legislation today? We've heard that Republicans have no plan. Well, on the contrary, Mr. Speaker, we have multiple pieces of legislation. I, in fact, have H.R. 2300 that is a patient-centered bill that makes certain that everybody has affordable coverage, that they are able to have the financial feasibility to purchase the coverage that they want, not that the government forces them to buy. That portability is solved, that you don't lose your insurance if you change your job or you lose your job, that we solve the whole challenge of pre-existing illnesses and injuries, but in a patient-centered way, not a way that the government forces you to purchase what they want you to purchase, and it would provide insurance for every single American. Second, we've heard this isn't a responsible piece of legislation. Mr. Speaker, let me suggest that the American people think this is a responsible piece of legislation, where over 80% don't think the IRS ought to have a thing to do with their health care. We've heard that this bill isn't going anywhere at all, that why do it? It's a futile attempt. Well, I'll remind my colleagues on 7 pieces of legislation, bills passed in this House, bills passed by the United States Senate and signed into law by President Obama that either repealed or defunded portions of his own health care law. H.R. 4 repealed the small business paperwork mandate. H.R. 1473 cut $2.2 billion from the stealth public plan and froze the IRS budget. H.R. 674 saved taxpayers $13 billion by adjusting eligibility for Obamacare programs. H.R. 2055 made more reductions to the Independent Payment Advisory Board in the IRS. H.R. 3630 slashed billions of dollars from Obamacare's slush funds. H.R. 4348 saved another $670 million from the boondoggle, the Louisiana Purchase, that was included in the original bill, and H.R. 8, which repealed the Unsustainable Class Program. All of those repealed or changed portions of the Affordable Care Act signed into law by the President of the United States. We've heard heart-wrenching stories from our friends on the other side about health challenges and illnesses. And yes, Mr. Speaker, there are real challenges out there. As a physician, I can attest to that, having spent over 20 years taking care of patients. But the American people don't want Washington deciding what kind of health care they must have or can have. We need patients and families and doctors making those medical decisions. And then the preposterous assertion from the other side that Republicans don't like affordable care, quality care, accessible care. Nonsense, Mr. Speaker. Nonsense. What we want is the highest quality of care that respects the principles of affordability and accessibility and quality and choices and responsiveness and innovation. We simply want patients and families and doctors to be in charge of health care, not Washington, D.C., and not the IRS. I urge support of H.R. 2009 and yield back the balance of
A congressional hearing today investigated the National Park Service's mismanagement of its firearms inventory, uncovered when an audit found many of the agency's weapons unaccounted for. Utah Congressman Bob Bishop questioned National Park Service Director Jonathan Jarvis about the issue.